Like Eric said, my name's Chuck. I'm the field service technician for the area. But yeah, just kind of go over the care and handling of the flexible scope. As Eric mentioned, it comes down in the basket. Your first thing that should have happened up in the room, they should have done like a pre-cleaning to it, right? They should have taken like an enzymatic brush, detergent, Raytex, something just to wipe it off, so that way it makes your life a little easier when it comes down to decontam the dirty side to where you can clean it, right? So so the first things first is what you want to do is you want to do a dry leak test, right? So you guys say you have the manual or the reverse scan. So for just for our sake, I'll just for example for the Karl Storz, let's just say we're using the Karl Storz. We attach it to this block right here. We want to pressurize it up to 200 for a dry leak test. And then when you pressurize it up to 200, what you're going to do is you're going to use this lever right here. It's going to deflect the distal tip of the scope. And while you have the leak tester attached, and what this does is if you have it in a straight formation, just think of it as like a scab, right? Like it's closed. So if you deflect it, you're going to deflect it 5 times in each direction. And the purpose of deflecting it is it's going to open up any potential holes that might be sealed while in the straight formation. So if you deflect it, hopefully the point of it is it's going to open up what might be an exterior cut on the shaft of the scope, and it's going to release that air. And then what's going to happen is on the leak tester, you're going to see a drop, right? Everyone's familiar with the drop. At that point, it's a failed leak test, and that's hopefully that's not the case. So if it does fail the leak test, just whatever your protocol is here for a failed leak test, that's the way we're going to take it. Let's just say it passes. So it passes. We're going to decrease the pressure down to 180. We're going to drop the scope into the. Let's just pretend this is a sink of water. We're going to drop it into the water. But with the leak tester, you don't want to drop the leak tester in the water, right? Because what happens is if you drop the leak tester in the water is going to get into the leak tester, and it's going to that little port right there. It's a little bent. The leak tester, when it's attached, it opens the port. And then water is going to flow up and then get inside the channel of the scope, and it's going to cause fluid invasion. All right, so just make sure that the leak tester is outside of the water, and then you're going to take your other hand while watching the leak tester, and you're going to deflect the scope and hold it in each direction for 15 seconds. So you're going to hold it in like this formation, the up formation for 15 seconds. And what you're looking for bubbles. Than anything that might have got by with the dry leak test. If you see bubbles, then it's a indication of like a leak in the scope somewhere. So it's a failed leak test. So you're going to hold it 15 seconds in the up straight formation, 15 seconds in the straight formation, 15 seconds in the down formation, 15 seconds back in the straight formation for a total of a minute. All right, and you're going to do this in water without the enzymatic mixed in. That way, if the enzymatic's mixed in, you're not getting any kind of like false results of the bubbles from the soap popping up in the. So once it passes the leak test, wet leak test, you're going to pull the scope out of the water. You don't want to release the leak tester inside of the water. Again, it's going to open up the port. Take the scope out of the water, depressurize the leak tester back down to 0, detach the leak tester, and then you're set to go with your manual cleaning to where you can mix the appropriate mixture of enzymatic into the sink, and that way you got the correct mixture of soap to water. So you can dip this in the port in the water, but the actual leak tester that you're holding. That can't go in the water. Okay. All right. No, it's a good question. So, so the actual hand tester that you have in your hand cannot go in the water. All right. This with the leak tester attached can go in the water. Okay. Just when you detach it, or even just when you detach it from the scope, lift the scope out of the water, depressurize it back down to 0. And then detach it from the scope before you drop it back into the water. Yeah, per our IFU, we recommend doing both a dry and a wet leak test.
Oh.
For lint-free cloth, we're going to dap the exterior of the scope. We're going to wipe it down, and then when you get to the shaft of the scope, this is just very important to take note as well. You don't want to take your lint-free cloth and grab it really tightly and pull, right? So you want to avoid pulling down on the scope. And the reason for that is this is rubber. So over time, if you're grabbing it and pulling it, it's going to stretch the rubber of the scope, and eventually what's going to happen is the rubber is going to extend over top of the distal tip of the scope, and it's going to cause an overlap. And then when they go to use it, I've seen it to where they stick it inside the patient, and then they're like, oh my God, I can't see anything, and then they pull the scope out and they're asking for a new scope, and I come in and I look and I'm like, oh, the rubber is just over top of the distal lens of the scope, and what I do is I just really gently take my two hands and I just pull the rubber back. But also what that does is when you stretch the rubber, it thins the rubber in certain spots of the scope, of the shaft of the scope. And what that does is the shaft of the scope is more accessible to exterior cuts now because the rubber is so thin. And then what that does, it causes a failed leak test, and now you're exchanging it out and having to send up a repair. All right, so that's just kind of thing. So when you're wiping the shaft of the scope, just kind of take it, dab it down, wipe to your best ability, to where you're just not pulling and tugging it.
We even use the sponges.
Or like a wet Raytech or a lint-free cloth or something, just like take it and just dab it down to get it wet and get the.
You talking about those little like circular sponges that kind of control
Yeah,
where those are nice
yep,
too.
Yep. And again, this is where pre-cleaning up in the room does good as well, because if they're pre-cleaning it in the room, it comes down here, it's not dry. Excuse me. Once we wipe off the exterior, we got all that debris off. We get that, you have your caps on there. You're going to take the appropriate size brush. You're going to stick it down, to your point, you're going to stick it down the channels of the scope. You're going to follow it down all the way till it comes out of the distal tip of the scope. And when you're sticking the brush through the scope, you also just be very mindful of this as well. You want to make sure the shaft of the scope, the distal tip, is in a neutral formation, like a neutral position, right? Mm-hmm. If you have it to the left or to the right and you're sticking that brush through it, it might puncture the inside of the scope, and now you've damaged it as well, all right? So just make sure that the distal tip of the scope is in a neutral formation. That way the brush of the scope rolls through the scope smoothly, and it's not hitting up against the wall.
Question about that freak brush. After you run the brush through it 3 times, then you use the freak brush, but how far you stick that freak brush down in there?
You talking about the little small one like this?
Yeah.
Just stick it down and just twist and turn it, and you pull it out. You wipe
just to the end of the brush.
Yeah, yep. And then you pull it out.
You don't want nobody jamming it in because it might not know.
I'm talking about right now. I'm just talking about the long brush that goes through the whole scope, right? So some people, once it gets to the distal tip, they pull the brush all the way through. Some people will wipe off the distal tip of the brush and then they pull it back up through. Wipe it off, stick it back through. You want to do it for a total of 3 times.
Which one is the right way? Which one?
I always recommend sticking it through, wiping it off, and then pulling it out. I'll pull it back up, and then once I pull it up, I'll wipe off the brush as well, and then I'll stick it back through. So you're going to do a total of a minimal of 3 times, but that doesn't necessarily mean you have to stop after 3 times. After your 3rd time, if you still see debris either being pushed out or pulled out, continue to do it until it's safe to continue the next step, right? All right, cool. Any questions about brushes? No. So the 2nd time, you just want to do whatever the recommendation is on the enzymatic cleaning that you're using. I don't every facility is different, uses different soaps. So just make sure that whatever the recommendation is, to make sure that you're appropriately soaking the brush or the scope in the enzymatic water. All right. All right. So you're going to take your little brush, you're going to push it down, you're going to twist it 360 degrees, you're going to pull it out, you're going to wipe it off, push it back in, minimal of 3 times for each port. If it's still debris is still coming out, you're going to continue to do it, until you feel safe to proceed with the next step. All right? All right. So now we have your detachments, right? You have your attachments with the green port and all that stuff. You're going to take your syringe. You're going to draw enzymatic up through the 60 cc syringe, and you're going to attach it to the scope. You're going to take your distal tip. You're going to place it in an empty basin or an empty sink, and you're going to flush enzymatic fluid through the shaft of the scope into like an empty sink. Anyone want to guess why you want to flush it into an empty sink and not into the sink that you're using to clean the scope?
To see if it's clean.
So if you're pushing any kind of debris that the brushes might not have gotten when you did the brush, you don't want to put that debris into the sink that you're cleaning the scope with, right? So that any kind of debris that you push out, you're gonna push it into an empty sink.
So we do that before, we perform
do all that before you brush.
hook it up
You
to
use
the
the scope buddy.
The
Yeah,
spare
yeah, that's right. So
We
that's
didn't
okay.
know that.
Yeah.
Not to be
Scope
funny.
buddy.
Yeah,
Seriously.
no. I mean, that's just what our IFU says. That when you're flushing or flushing fluid through a scope, just put it in the empty sink, the distal tip, so that way any fluid or any kind of debris that's coming out of the scope is not floating, or like you don't want like debris or
What size
boogers or
syringe?
anything like that.
60.
60. We recommend at least a minimal of 100 milliliters of fluid to be brushed through the scope or flushed through the scope, and also to be drawn up through the scope. A minimal of
So
100
you have to do
milliliters.
this as well as the scope buddy.
No,
it's
no,
If you're not,
that's
if you're
just
using
one.
the scope
So
buddy,
this is
you don't need this step.
So I'm just going off of what our IFU says right now.
Okay.
All right.
Okay.
I know in the
But so
past,
we
like
do
we've talked to and
Scope
used the
buddy.
scope buddy. Other facilities use the scope buddy. I can't necessarily speak on the scope buddy just because it's not my product, and I'm not. I'm just going by what our IFU says.